am Dr. Ben Gar. This is Gar Dental Center in Carrington, North Dakota. So we are in the dental field. Maybe many of you have been to the dentist and you think that's the most boring thing ever, and why would you ever want to be in someone's mouth? And so we're here to show you that maybe it's not all what you thought it was or what your experience in dentistry has been up to this point. A lot of times what you experience in dentistry is really just getting maybe some fillings done, or maybe some braces, or maybe your cleanings, but there's so much more in dentistry than just what you experience up to this age. Hopefully today you get to experience a little bit more of what we do. But to give you a little background and introduction to dentistry, there are a lot of dental fields or dental opportunities in the dental field. You can be a dentist. A dentist requires a 4-year degree after college, and you can specialize after that for another 2 or 3 or 4 or 6 years, depending on what you want to do. Like to be an oral surgeon, an orthodontist, endodontist, or whatever. Or you can be a dental hygienist, which is an associate degree or sometimes a bachelor's degree. Or you can be a dental assistant, and there's training in school and there's training on the job for that. You can work in the lab technician areas where you're making a lot of things for the dentists. And there's all the other help and other folks that make it all happen too behind the scenes. So there's a lot of opportunities in dentistry. Sometimes you might look at all these careers and you'll see charts of average incomes and average school and average this and average that. I would have to look to see what it actually is nationwide. It's probably $150,000 for a dentist, or $200,000 or whatever. But those are all averages. So if you want to be average, awesome, good. If you want to be above average, though, there's plenty of folks in dentistry that make a lot more than that. Just depends on what you want to do. If you want to own offices and be a businessman or woman, dentistry is awesome for that, because it is more than just a small office where you work with a few people. You can do anything you want to do in dentistry. So the world is wide open for you. So this is our newest addition to the family. This is my most favorite toy, latest toy that we've gotten. This is called the Solea Laser from Convergent Dental. It's a pretty unique laser, in that it can cut both gums and tooth, so hard stuff and soft stuff. How it works is it has a big computer and brain and all the stuff that creates the laser inside, and it shoots it up this tube, and it hits a mirror, and it bounces over here and hits a mirror, and bounces up here, and hits all these mirrors, and then inside of this, it changes that laser from one teeny little beam, and it'll kind of bounce it around, and it can bounce it to a larger diameter. When I say larger diameter, it's like 1.5 millimeters, so it's really kind of small, but the world we work in is pretty small anyways. So we can change that spot size of how big that diameter is, and this is what we're talking about. So that green light is just like a light that you shine to get your cat kind of frenzied, you know, and jumping around on the wall trying to jump and find a light. So it's just a colored light. The laser is not visible. That's why we have these cool glasses, so it doesn't hit our eyes and mess with anything. So we're going to just demonstrate how this works on an apple, which is not quite like a tooth, but it's kind of fun anyways. So it's so fine that you can just take the skin of the apple off without actually going into the meat of the apple. And I'm just hitting the pedal really gently and it just barely takes the surface of the apple away. So we can actually treat gums and all sorts of things with the soft tissue without even having to numb the patient up. And so that's kind of what it can do. That's the wide version. If I want to make an incision, I can hit the pedal down all the way. And now we can make an incision into the gum. It smells a lot better when you're cutting an apple.
Another benefit the laser has is when we're cutting, it cauterizes everything also and disinfects, so it makes everything really clean.
Yeah, we don't get much bleeding when we're doing it with the laser. So that's with the gums. So if we had a cavity, we can just kind of take the cavity right away with the laser. And we don't have to numb people up. It feels cold. Kind of like you're biting into ice cream. And so we can really just kind of take care of that cavity without even having to numb people up. So you can go home, you can go back to school without having a numb face, a numb lip. So that is our newest, latest, greatest toy. So I mentioned that when we use the laser, you don't have to be numb. So I would say probably 85–90% of our patients don't need to be numb when we do fillings with the laser. And they'll ask, well, how is that possible? Because I'm always numb when we do fillings. So if you've ever mowed the lawn with a push mower or done a weed whacker like a weed eater, and it kind of vibrates and shakes your hands, after a while those hands kind of go numb. So the brain is getting so much stimulation from the hands and from that vibration that the brain just kind of turns it off. So they go numb. So the laser is pulsating at such a fast pace that the tooth is getting so much stimulation there that the brain just kind of turns it off. So it kind of makes the tooth numb a little bit. It's not quite the same as being numb with anesthetic with a shot, but people much rather prefer that over being numb and everything else. So that's kind of how it works. It just kind of numbs up your tooth, and then we have a few minutes to fill it up until you finish the filling and complete all that work before all that sensation kind of comes back. So that's how the Solea Laser works. Okay, welcome back. We are going to show how the digital world has influenced dentistry. So we have a Cerex scanner. It's a prime scanner. It scans in 3D. So instead of having to use the goopy stuff and take an impression, we are going to use an optical scanner and show how that takes the live version and puts it into a 3D version in the computer. And then with that, we can do all sorts of things. We can use it to make a crown or a veneer or a bridge or anything to replace a tooth. Or we can also take that information and put it into other softwares and do things for orthodontics, braces, Invisalign type of stuff. We can print out a model of your mouth. We can make mouth guards. We can do all sorts of stuff once we get in that digital world. And then there's all sorts of softwares that help make all those different things. So we're going to sit our patient Brooke back and show how this works. So this is probably the 6th generation of this particular company's version of a scanner. So it's about 30 years old, but I'll tell you the stuff that we've had in the last few years is light years different than what it was even just 8 years ago or 10 years ago. So you see this blue light that's kind of shining on her chin here. It's actually taking all sorts of images, about 12 images per second. And it stitches them together into a 3D version of your mouth. So you can see how it's like in live sequence making, stitching that all together and making the actual model over there. What's really cool is even if I scan my finger or a lip or tongue or something, it just kind of knows to erase it, as it's not really there. So it's kind of a self-intuitive program. So there is the 3D version of Brooke's mouth. So if we were going to do a crown or an onlay or a veneer or something for a tooth, we would scan the upper jaw, we would scan the lower jaw, scan them both together, how it fits in the bite, and then create a tooth. So that's what we'll show you next. So we've scanned in this model, which shows a tooth that needs a crown on it. And so this is what it looks like here. If we fast forward, it will give us a proposed tooth on there. So there's a lot of like AI built into the computer. So if you can see that, that is the version right there. It creates a tooth where there is no tooth. And then from that we can print it or mill it out of a block of porcelain and then put it right in the same day. So instead of having an impression with the goopy stuff and send it to a lab and 3 weeks later you get the crown, we can do the crown right away the same day. And the patient, sometimes patients drive for a long time or they don't want to go without a tooth for a while or whatever, so we can do it all kind of the same day. So that is how technology is changing dentistry, and it's changing really rapidly. And the last 5 years it's really been going crazy. So it's kind of fun to keep up with all the technology in dentistry. And I would say with the laser and the scanning and cone beam X-ray, which is kind of like a CAT scan that goes around your head and gives a 3D version of the bones, we can take the 3D version of the bone and teeth and stitch it together with the 3D version of the teeth like we just scanned, and now we have this working model of not only the teeth themselves but what's underneath, the bone and everything, so we can rebuild with implants and dentures and all sorts of stuff to recreate what's been lost either through injuries or cavities or neglect, or sometimes people are just born without teeth and they don't have any. So I would say we probably have in the office one of the most technologically advanced offices in the state, which is kind of fun to be able to use that to benefit our patients. So like I said before, one of the things that we can do with scanning in teeth is we can 3D print. So we can take this file, create what's called an STL file. It'd be like a doc file or a PDF file or something. It's just called the STL. And that is how things get printed. So we take that file and send it to the printer, and then out comes your teeth in a 3D version in resin. So we can use this to make, like I said, all sorts of things, from night guards to orthodontic moving trays like Invisalign trays, all sorts of things. So without even having to do the goopy stuff and impressions and pouring up models with stone. So this is the newest, latest stuff in dentistry. So let's talk a little bit about hygiene. This probably sounds super boring, but if you think about your mouth, like we carry it with us everywhere we go, and yet we sometimes don't realize what we're carrying with us inside our mouths. Sometimes we'll talk to patients or folks around and say, so show me how you brush. And it's kind of shocking sometimes that we, as a general population, we really don't brush really well. We might brush, but we may not clean. So sometimes in kindergarten, the dental community will go in and show kids how to brush when they're 5 years old, which is great. I love it. But if that's the only instruction we ever get, imagine a 5-year-old being taught how to drive. And then they turn 16 and we just say, here's a license, go drive. I would dare say we'd have a lot of wrecks. So we need more instruction than just a kindergarten class to show how to brush. And a lot of that comes from parents and responsibility with just teaching kids how to brush. But sometimes as adults, we might have a driver's license, but really we're not very good drivers. So just because we brush doesn't necessarily mean that we're great cleaners of what's in our mouth. So we're going to kind of go through what that is, what we're looking for, that is more just, that is not just about cleaning stuff, but what's actually in our mouth and what needs to be cleaned out to be able to be healthy. If we try, sometimes we'll see people try and cheat when they're brushing. I'll give you a little example. So an example of cheating brushing is like, I go in and I brush. Usually people brush about 20 seconds. That's like average. But it really takes about 2 minutes, sometimes 3 minutes to actually clean everything. So if we're only giving ourselves 20 seconds, we're probably cheating ourselves of some good healthy gums and teeth. So people will close and then just brush and brush and brush and brush. So when we do that, most of the time we're just brushing the surface, but we're not brushing down on the gums. So what we recommend is to open and brush the bottom teeth separate from the top teeth, and make sure you're going down by the gums. What we're going to show you, what Chris is going to show you is we take samples. We just kind of put get a little sample of some of the gunk that might be around our teeth, and we put it under a microscope. Now you guys have seen microscopes and see what they do and see all sorts of stuff with that. But it is amazing to see what is in our bodies. We have good bacteria and we have bad bacteria. When our body is healthy, the good bacteria thrive. When we're not healthy, the bad bacteria thrive. So there's a difference between good bacteria and bad bacteria. When we have good gums, we have great bacteria. When the gums are unhealthy and there's a lot of inflammation, bleeding, then there's a lot of bad bacteria, and we can see that on the microscope.
My name is Carissa. I'm one of the registered dental hygienists at Guard Dental Center, and I'm just going to kind of show you guys how we go about taking that bacteria out of your mouth, putting it onto a microscope slide so that we can show our patients and teach them what the bacteria looks like in their mouth and how healthy or unhealthy that bacteria may be. So when we do have a patient, pretend if this was your patient's mouth, we take one of our instruments and go ahead and actually just scrape off some of that plaque off the patient's mouth. We go ahead and take our slide, put a little bit of the solution on there, and we try to kind of tap that plaque off onto that microscope slide to get a good sample. We'll dry that off usually, and then we can go ahead and transfer that to our microscope. Once we do that, it will come up with a screen similar to this, and we can show our patients their moving and live active bacteria. This is kind of what we use to describe what is healthy, what is unhealthy. So if we're seeing a lot of active bacteria moving all over the place, swimming around, that's kind of what tells us that we have that active unhealthy bacteria. All these long curly spirochetes, these long rods, put patients in that high risk category for gum disease, periodontal disease, gum infection, bleeding, things like that. So on a healthy patient, we would like to see less movement, not a lot of active bacteria, more of kind of a clean slide that doesn't have a lot of activity going on.
So that's really what's happening in our mouths.
Correct.
We have like swimming bugs in our mouths all the time, right?
Right. And this, keep in mind, is a sample from one area of just a small tooth. So imagine, how much bacteria is living on every other tooth inside your
So there's
mouth.
thousands that we see just in this little teeny speck that's on the slide.
Correct.
So how do we make the bad bacteria go to good bacteria so we're healthy?
So to get rid of the bad bacteria, there's a few different things we can do. Obviously, good oral hygiene, removing that plaque, that biofilm that's living on our teeth. This bacteria lives in the plaque in our mouth, so removing that with brushing, flossing, keeping everything really nice and clean. You sound better than
So
me.
in addition to cleaning off the bugs, which is important, and if we think about it, really when we brush the top surface of the teeth, we brush the side, we brush the other side, but it's like a box with 1, 2, 3, 4, 5 sides. So when we brush, we're only brushing 3 sides. Those other 2 sides are just left not getting cleaned by just simply brushing, and that's really good brushing at that. So what happens when we don't clean the other 2 sides? Well, that's the part in between the teeth. And where are most all of the cavities that form, especially in teenagers and later adults, it's between the teeth. You don't see them. We see them on x-rays when they're smaller, and then we see them in the mouth when they're huge. So that's where flossing, that's the only way to get between teeth really well. But also, so we're cleaning off the bugs. We're using therapeutics like antibiotics to clean things off, to kill the bad bugs and leave the good bugs. We're using different solutions and rinses and things like that. So, but that's when it's happened. So why did it get there? We need to have a better nutrition going on than that will help create a better healthy environment. So listen to your parents, eat a little bit more fruits and vegetables, lay off the soda. Soda will just bathe all those teeth, and we're only brushing the 3 surfaces, and it sucks into the other 2 surfaces, and that's where we get a lot of cavities. So one thing that I'll show the kids, or at least describe to the kids, sorry, you're still considered kids if you're my kids' ages, is that bacteria, what do? Why do they create cavities? These bacteria eat stuff. Well, what do they eat? They eat sugars. So where do sugars come from? It's not just candy, but sodas for sure. But Gatorade has just as much sugar as soda does. Does bread have sugar? Yes, it has carbohydrate. So wait, that's a big word. Carbohydrate is sugar. So even healthy things can have sugars, crackers and breads and stuff like that. So any carbohydrate is going to feed the bacteria. Bacteria eat this carbohydrate and they leave a deposit behind. That's kind of like bacteria pooping in your mouth, and they poop out acid, and that acid eventually erodes the tooth, makes a big hole in the tooth, and that's where cavities come from. So those are all the big nasty bugs swimming around. They're pooping in our mouths, creating acid, and that's where cavities are. So clean the bugs, clean everything off, keep it really healthy, and you'll enjoy a healthy mouth for a lifetime.